I'll get right to it now. We're going to have a talk by Brendan Nyhan. Brendan Nyhan's an assistant professor in the Department of Government at Dartmouth College. I'm sorry, but I have to point out that my younger brother Ben also teaches in that department. I've mentioned to Ben that his decision to help recruit and hire Brendan, and also his colleague, young colleague, Herschel Nachlas, represent two of the first really good exercises of judgment, in my opinion, in his entire life. And I wanted to make sure that, I told him that this is going to be the kind of thing that makes our parents proud, and he should keep it up. Brendan's research focuses on misperceptions about politics and healthcare, and he's thought a lot about the substantive focus of our topic today, having been a Robert Wood Johnson Scholar of Health Policy Research. He's also having a big impact on more general discussions about the role of media in politics. He's a pioneer in a new form of public affairs information provision, which is this hybrid academic journalist description of social scientific evidence for the lay audience, which several folks in the audience are involved with, and Brendan was one of the first. He worked at the Upshot at the New York Times. And so really excited to hear from him. We're going to hear Brendan talk today about the challenge of false beliefs, understanding and countering misperceptions in politics and healthcare. Thanks, Brendan.
All right, thanks very much. It's great to be here. Thanks to the organizing committee for inviting me, and thanks everybody for coming out. What I want to do today in the brief time that we're allocating for the talk is just to give you a sense of why I think the misperception problem is important, what we know about how to address it, and where there are needs for new initiatives and new research. Okay. So the problem I'm interested in is the problem of misperceptions, when people believe things that are false or unsupported by the best available evidence. That crops up across controversial issues of public concern, from politics to healthcare. So here you can see in the slide, in the left panel, the famous death panel myth during the Affordable Care Act debate, and then on the right, the myth that vaccines are poisoning our children. And so for lots of controversial issues, misperceptions are common. There's very much a denominator, as Dan emphasized in the morning session, of issues where people don't have salient misperceptions, or ones that they hold very strongly. But I think the misperceptions that are pervasive are often of great public concern, and they're often on the issues we care about most. We're most likely to observe them precisely on the issues that people have the strongest feelings about, or that implicate aspects of their identity. And that's why normally I think they're a great concern, even if you go issue by issue, they may be relatively rare. There's a disproportionate share of misperceptions on the most important and salient issues, and involving the most important and salient public figures. And those are the ones I'm going to be focusing on today. So the problem in how we address these is what's often called the deficit model in science communication, which I don't need to reiterate in any great detail for this audience. But the basic idea is there's this underlying presumption that the facts will dominate in politics and public policy. They will drive public opinion, and they will influence policymakers. And whenever we observe claims being made in contradiction to the facts, the best response is to provide more information. People must simply be lacking in information, and we'll provide to them, and that will solve the problem. And I don't think that's a view that too many people would stipulate to when you put it that way, but it's the underlying presumption of so much of what we do in education, in journalism, in health, in science, and in politics. And what I've tried to do is to push people to think harder about that, especially when it comes to these controversial issues, where the response we get is very different, right? People aren't waiting for the facts to show up. They're often responding more like this. Right? So one of the most common responses to corrective information on controversial issues is disconfirmation bias, this skepticism we all have as human beings when we encounter information that's inconsistent with our predispositions. And there's a variety of evidence that we can show you that when people's identities or partisan beliefs are salient, or when issues are especially controversial, people may be very resistant to the kinds of information we might like to share with them. And simply giving them that information may not have the effect that you expect or intend. Okay? And that's one of the things that I've tried to explore in my own work. So the white paper reviews a series of reasons that misperceptions are common. The motivated reasoning that I just described is one of those, but it's certainly not the only one. A couple of other important ones, this is by no means an exhaustive list. There's a body of literature about the kind of cognitive approaches and limitations we all have, again, as human beings, that might make us prone to accepting information we've been exposed to, even if it turns out to not be true, or to believe, for instance, through a fluency heuristic, that information that feels familiar is true. So even if we've heard about something in the context of being told it's false, over time we might lose that false tag in our memory, and it feels familiar, and we might therefore infer that it's true. Or finally here in the third category, the third bullet, that social category differences may be especially likely to facilitate misperceptions. People in the outgroup we may be especially prone to believing things that aren't true about them, or resistant to corrective information about them because they're not a member of our own in-group. So the question this all raises is, how effective are the different kinds of myth-busting approaches that we so often see, right? Whether it's in politics, here with the PolitiFact website and other fact-checking efforts like that on the left, or the kinds of health myth facts, and this is a health facts and myths document from the CDC, right? How effective are these sorts of approaches at countering misperceptions? And we tend to assume, again, that the solution is to say, here's the myth, here's the facts, and people will update accurately. And in some cases, we might even expect, as in the case of this flu vaccine flyer, that people would change their behavior as a result of exposure to that information. But because of the dynamics I described earlier, that may not always be the case. And it's really an empirical question. Again, I think this underlies a lot of what we've said so far today, but I don't think we've underscored it quite strongly enough. We just simply have to test more of these messages empirically. We need institutional partners to cooperate with us, who are assuming that the efforts that they're making to provide information to people, different kinds of audiences, it's frequently going to be an open empirical question whether these messages have the intended effect. And it's very easy and cheap to do simple RCTs to evaluate how effective they are, right? And I don't want the message that you take away from this to be that none of these things work. It's that we need to test and find out. And we can learn things about which ones are more or less effective. And I'll show you some examples at both extremes as we go forward. Okay, so here's the most famous counterexample from my own research was this original study we did where we found what we call a backfire effect, when we gave people corrective information saying that, in fact, Iraq did not have weapons of mass destruction or an active weapons of mass destruction program before the US invasion. And we found that it appeared to provoke counter-arguing such that conservatives who would be predisposed to believe President Bush in the context of the mock news article we had provided to recipients were actually more likely to agree with the statement that Iraq had weapons of mass destruction than when we didn't provide them the correction at all. Okay, so that's an example where giving people more information could actually lead them to believe more strongly in a given misperception. But I want to suggest to you that's always the case. That's an extreme case, and I'll show you some examples where there may be more effective approaches we can use. Another possibility, though, is that even people may accept that information but not change their behavior. Right? So we talked about the smoking case of this earlier. People widely accept that smoking causes cancer, but many of them haven't changed their behavior. Here's an example from research that my co-authors and I did about vaccine attitudes and beliefs. We tested the effect of corrective information telling parents that the measles, mumps, and rubella vaccine did not cause autism, a very commonly believed myth that many people think contributes to vaccine hesitancy. Now, when we gave people that information, they were less likely to believe in the myth itself. So we found that belief in the myth, the autism myth, did decline significantly with respect to a control condition. There's other messages we tested here that I won't talk about, but I'm happy to talk about in the Q&A. However, when we asked them, how likely would you be to vaccinate a future child with the MMR vaccine, we found that the parents who had the least favorable attitudes towards vaccines, so this isn't just the hardcore anti-vaccine folks, this is approximately the bottom third of the US population of parents with children at home in terms of their attitudes towards vaccines measured in a pre-treatment wave. Those parents were actually less likely to say they would vaccinate a future child rather than more. So it had the opposite of the intended effect. on the behavior that's of greatest interest for public health when it comes to vaccines. So again, that is an example where the public health community hadn't tested those messages. They've insisted on great rigor in testing the effects of the drugs that they license, but the messages that are being used to promote drugs and other kinds of medical interventions like vaccines are almost never tested rigorously. Okay. So that's the sad news. I've depressed you all. So now here's some happier news. I don't think that's always the case, right? So the effectiveness of corrected information is going to vary depending on the salience of the topics in question, the extent of the partisan cues people have, how well-known the public figures are, and so forth. So my co-author Jason Reifler and I did the first, to my knowledge, longitudinal trial evaluating the effects of fact-checking exposure during the 2014 election. So during that election, we exposed people in 3 waves to real fact checks from PolitiFact. And then after the election, we asked them about the factual content of those fact checks. Now, because it was a midterm election, the political figures in question were not as well known. The issues in question were not as controversial or as salient. So I think it was a better case for fact-checking to work. And in fact, what we found was that belief accuracy did improve for both people with low and high levels of political knowledge, and for issues that where the correct answer, the accurate answer, the one that reflected the evidence available, was either belief consistent or inconsistent with their political predisposition. Okay? So in a case where the circumstances were less partisan and the issues were less familiar, we found the fact-checking exposure did increase belief accuracy significantly. We can also think about different approaches to providing corrective information that may be more effective. And this is in keeping, for instance, with the spirit of Peter's presentation this morning. We tested the effects of providing graphical information as opposed to text. In a study, again with Jason Reifler, we took graphical information showing the increase in global temperatures from 4 independent data sources from a NASA press release and the equivalent text from the press release itself. So experts had decided that this text was equivalent to that graphical information, and we tested what effect it had on misperceptions about climate change. And we found they declined significantly more when we showed them that graphical information relative to text. Now, not every misperception is amenable to graphical correction, but there may be opportunities for these kinds of more creative approaches. And again, it's often going to be an empirical question what's most effective. We've written a couple of reports providing a whole series of recommendations for best practice in this area. And in some cases, for instance, it may be helpful to provide a causal explanation for some event where a misperception has helped fill the void. You can think of, for instance, 9/11 misperceptions and conspiracy theories often are based on a kind of misunderstanding of what happened, and you need an alternative causal explanation. That was one of the concerns, I think, with the weapons of mass destruction case. Why did Saddam Hussein not explain that he didn't have the weapons of mass destruction to avert the US invasion? There's a kind of underlying causal question there that leads people to fill in that gap. And so it may be effective to provide alternative causal explanations, and we provide evidence in a study of how you might do that and show that it does appear to help. And there's a series of recommendations here, and I would just say that, again, these are things that we need to test empirically and also communicate to the kinds of folks who are designing these messages in institutions, in public health, in journalism, right? Because they're often thinking about how they can most effectively convey information too. And in a lot of cases, they're not following what we would consider to be best practice. So there's a lot we still don't know, of course. There's a whole series of areas that I outline in the paper where more research is needed, including the self-affirmation research that we discussed in an earlier session. The extent to which people are, for instance, selectively reading belief-consistent fact checks is something I think we haven't taken seriously enough. Even if people are reading fact checks, they may be reading them like a fan of a sports team reads a sports page to see if their team won or lost, and picking and choosing things based on how well it squares with their with their preferences over who should be right. So there's a lot still to learn, but this is an area that's come a long way and not very long. So I'm optimistic. Now, with that said, I want to be a little more contrarian here in terms of the focus on public communication that this conference, as well as almost all science communication discourse, typically has. There's almost always an assumption that our focus should be on communicating directly to the public. And I think that leads to a kind of overpromising of how much messaging can deliver. Working in this area for a long time has made me very skeptical about people who make grand promises about changing public opinion, because I so rarely see evidence of people being able to do that systematically at scale. There are no magic messages. I don't think they exist. There's often this search for one. Climate change, you can think of climate change communication as a 20-year search for the magic message that will persuade everyone that climate change is real. I don't think that message exists, and I think that's the wrong approach to the problem. Vaccines, similarly, I read a letter to the editor from a doctor once who said, we're one brochure away from solving the vaccine hesitancy problem. What people think this is never clearly defined, but they just think it's out there somewhere, and we're going to find it. I don't think we're going to find it. And moreover, I don't think the fundamentals of human psychology are going to change anytime soon, and so we should think differently about some of these problems. Once there is a problem, we should think about how to communicate more effectively, but we need to think upstream. We need to think about when these kinds of problems develop, how we can intervene more effectively, and in those cases, I think the best point of intervention isn't the public, it's through intermediaries, elites in the media. Okay, and that applies especially to expert communities like the kinds of folks in this room. No offense to you, because this applies to me as well. We're all likely to be more effective communicating with these folks than we are directly with the public. Right? That's where our skill set is strongest. Okay? And I think in a lot of cases, trusted intermediaries can make our case more effectively, and I'll describe an example of that in a moment. And I also think that elites in the media are creating the conditions where these beliefs become politicized. And thinking about how to intervene with them or to change the incentives they face may be more effective than trying to clean up the mess after the fact with messaging strategies. Okay, so here's an example of where trusted intermediaries might be more effective. Parents overwhelmingly say that their child's doctor is their most trusted source of information about vaccines, by far. It dwarfs the respect they have in terms of who they would like to listen to, the CDC or anybody else. Okay? Your child's pediatrician is who you will listen to about vaccines. That is the person who can communicate effectively. Right? I can throw all the science at you that you could possibly read about how vaccines don't cause autism, and I'm not sure how effective that's going to be. It might not even be counterproductive. But your child's doctor, that person is an important position to have a relationship with you where they could communicate more effectively. And I think that applies across a whole series of issues. I can talk about in the Q&A, but there's fascinating anecdotal evidence from the Ebola outbreak about how trusted intermediaries were critical to changing mourning and burial practices during the outbreak when simply providing information wasn't enough. We can also influence the media and the norms in the media about how to communicate about science. Okay? There's still a norm of objectivity and balance. I'm putting both of those in scare quotes because I don't necessarily believe in them as journalistic ideals that often translates to inappropriate characterizations of the strength of the evidence about scientific and public policy issues. Okay, so just to give you one example from a previous study, many of the articles in the earlier stages of the debate over vaccines and autism were inappropriately balanced. They mischaracterized the strength of the evidence. They presented it as a he said, she said issue. Okay? And we have experimental evidence showing that that misleads people. That makes them think that there is a divide within the scientific community that does not exist. Now, of course, if there is truly a divide on an issue, that journalists have every responsibility to represent that in their coverage. But the problem is the norm of objectivity and balance can mislead people. Simply presenting an expert on either side can make a 95-5 issue look like a 50-50 issue. Okay? And I think that really does mislead people and can contribute to these kinds of misperceptions growing and developing over time. The other point I want to make, the final point I want to make, is just simply that elites are driving polarization of many of the important issues where misperceptions are common. Okay, so I talked about death panels earlier. Here again is climate change, where we're seeing this widening partisan and ideological gap in people's beliefs about anthropogenic climate change. There's no state of the world that I know of no evidence that that is driven by people reading climate studies. That is driven by elites. This is a hard issue where people are getting cues from elites they trust. That is an elite-driven process. And so to understand why that happens, you have to look to elites. And my contention, which is simply an assertion at this point, is that That will change if and when the cues people get from elites change. It will not change because of communication from scientists. It will not change because we have a message that we haven't used before that suddenly changes everybody's minds. And so the action on this issue is going to be through elites. And if and when that's successful, you'll see those numbers reverse. And my contention is not until otherwise. And just to give you an example of how you might operationalize that, I think we have to think about the incentives for elites to make these claims that aren't based on evidence and science in the first place. There's very little reputational consequence for making inaccurate claims. Almost none. In fact, you could argue that being controversial helps get you more attention on cable news, more bookings, in some cases for politicians, more fundraising. The incentives are completely perverse. We need to rebalance that. There need to be consequences, not legal ones. I'm a free speech absolutist on this point, but ones in terms of civil society and the media and how we treat people who mislead the public. They are victims here. They are not the perpetrators. So if we hold politicians accountable more effectively, that might change the incentives that cause them to promote these misperceptions in the first place. And just to give you one example of how that might work, Jason and I, in a study, randomly assigned a subset of state legislators in all the states that had, except for 2, in 2012, that had a PolitiFact affiliate in their state, to receive a series of messages from us saying, hey, PolitiFact is watching you, and if you get fact-checked, that could have major consequences for your political career, for your electoral fate, and so on. And we found they were, the folks in that treatment group were significantly less likely to make a claim that got a negative rating from a fact-checker, or that was the accuracy of which was questioned publicly in media coverage. Now you can see the base rate here is extremely low, which also tells you how little accountability there is in the first place. And of course, we're talking about state legislators. That's not necessarily the same as presidential candidates. And of course, the first response to this is of course, you're all thinking it, so let me say it, Donald Trump, right? Who's being fact-checked over and over and over again to not much effect. But he's really the exception here. I think most politicians are more sensitive to the kinds of media coverage they get, and there's a lot of opportunity to hold elites accountable for the statements they make. So let me stop there. Happy to take your questions.
Thank you very much, Brendan. So we have time for questions, and I think we have mics. Julia, you can take the first question.
First, a statement. I find it, I enjoy that the email that you sent the legislators was, in fact, misleading, right? Because earlier you said that PolitiFact doesn't actually change people's views, but you told the legislators that it would. But that's okay. That's my amusing observation. What I actually was, I was thinking about this morning, and I wanted to ask you about the use of intermediaries, and I wonder if, for you and also the rest of the panel, it's on your landscape. I don't know if it's an actual phenomenon, but according to my doctor friends, there seems to be an increase of distrust in doctors and their opinions, and people are more often going to WebMD, for example, to diagnose themselves. And so, I'm just wondering if that's on your landscape or if that's actually not a phenomenon. But is there, in the future, will doctors not be a trusted intermediary?
That's a complex question. I mean, I do think many people in the health community, and Peter especially could probably speak to this, are concerned about patients self-diagnosing on the internet. And there are studies showing that the kinds of information you get via search engines might not be very accurate. Whether that translates into a more general distrust of doctors, I would say I haven't seen any systematic evidence of that. I think we still hold scientists and doctors in quite high esteem. But within certain kinds of sub-communities, that may be less true, right? Where there's especially a kind of a subclass of folks who are both distrustful of modern medicine and educated enough to go out and try to sort through this information themselves and form some sort of judgment. But I'm not sure how widespread that phenomenon is.
Okay, our next question is from Professor Ted Brader.
Yeah, Brendan, when you had the graph up on the about changing attitudes by ideology in climate change, and you mentioned that you said we need to think about targeting elites, because that's not going to change just because we, scientists, researchers, try to change people's opinions on that. One question that's raised for me recently, given the other data we've seen, is that in fact what's happened over time is scientists have tried to change people's opinions on that issue in particular, as well as some others, is not only have we seen a changing attitudes in a negative direction on climate change among conservatives, but a changing attitude towards scientists and trust in scientists. And I wondered if your thoughts about what went wrong in it was the scientists, was our collective messaging strategy on these kinds of issues, was that the cause of that we politicized ourselves in this process, or was there something else that we, in our communications with elites, we became too imbalanced, or, you know, what are your thoughts on that?
That's a good one, and I should let Dan weigh in on this one too, because he's written a lot on this point. I would say, terrible. Everyone okay? That was to wake you up. My thought is that this is mostly driven, that there's an issue-specific kind of backlash against scientists, but the evidence of overall backlash towards science is probably smaller in magnitude than many people realize. So there has been a decline, and I'll let Dan speak to this because he's looked at the data more carefully, but there's been a decline in trust in scientists among conservatives, but the magnitude of that is quite limited. They're still one of the institutions held in highest esteem by every group across society. And why that is, you know, they're put in the position of being on that issue being politicized, and there's also been this, you know, corresponding trend. You know, we can talk about whether it's a causal relationship or not, of the science community becoming hegemonically liberal Democrats, right? Which, you know, we can talk about why that is and the exact extent of the prevalence, but it's hard to deny that that's happened at the same time. And so I think that probably feeds into politicization too. I would point to those things before I would point to messaging per se. Let me let Dan weigh in on this point.
I really agree with you. The one like maybe kind of illustration that I would add is that the same members of Congress, I mean literally the same ones who are on the committee that would cut the budget for NASA to study climate change, the vice chair, what's his name? Curtis? He's an Oklahoma representative who was the head of the Agriculture Committee in the House, took the money, it was several $billions, and put it into the Department of Agriculture budget to be earmarked for land grant schools to study climate change adaptation. And about $10 million went directly to East Oklahoma University, East Oklahoma University, which is in East Stillwater, his district. Farmers are the most climate skeptical. I mean, if a calamity happened and we lost all data on partisanship, we could reconstruct it by asking if people are farmers and recover part of it. But they also use the data and they listen to the scientists. So there's something stylized about saying I don't trust the climate. You don't trust them except when you do. And then you do trust them on the other issues. So it's almost like a kind of symbolic thing, I think. I don't think scientists cause the problem, or even have much of a problem, even if the rest of us have a huge problem because of people being skeptical about climate change.
Professor Badeska?
Thank you. So, very nice presentation. I think that another point that it's important to remember is that it's very easy to dismiss facts and information when you can discount it or say, that's not the kind of information that I was looking for. And I found, with personal experience and at least one or two studies, that if you push the other side, so what is exactly the kind of evidence that would change your mind? You design the experiment. You tell me what you need to do so that you don't have to change your mind, rather than presenting the information that is, you know, available to you or handed to you. That's one tool. Another tool, which I think and there are a couple of papers showing that that's effective, is pushing people who hold on to this myth to try to explain them in details and to follow through on all their consequences. So there are a couple of papers that, people who think, I understand how it works. And, okay, spell out, write a paragraph, explain the causal chain by which you believe that because of A and B and C, eventually. And most people, who hold very, very strong beliefs, actually are unable to do that. Because, basically what they remember is a stylized fact. And I think that has a very, very positive effect in dissolving some of these myths and reactions.
Yeah, no, thanks, very interesting. I mean, that second point I'll take first, this illusion of understanding literature. It's interesting, I'm not sure how it scales. It has the property like self-affirmation of being a really neat stylized paradigm, but I'm not sure exactly how we get people writ large to think about how well they understand things. And I would conjecture that the illusion of understanding, people who believe in climate change might actually be more vulnerable to it than the converse. I think very few people who say they believe in climate change could explain it either, right? So I'm not certain about how to pursue that, but I do think it's a very interesting paradigm. On the first point, again, I like the idea of it, but I'm enough of a student of motivated reasoning to think that there's going to be a kind of goalpost shifting process over time, right? So for instance, we've seen people adopt the claim that there was a pause in global temperature increase that was essentially attributable to some random variation, kind of knocking out the linear trend in a subset of the data. But that pause is over, and all the folks who are touting the pause have not gone back and reassessed their views. They've instead shifted to other arguments against acknowledging climate change. So that's the kind of process that I would expect to see and expect people to get cues about.
So, you're right. So there's something about effects that once they are established, they are much, much harder to basically eradicate. And I think there's interesting literature about the fact that, papers that are published and then are retracted, the beliefs in the results are still lingering after the papers, long after the papers are retracted. And it's just another example.
First, just a really quick comment on this trust point that we've been bringing up. So there is a literature by Susan Fisk at Princeton with regards to the determinants of trust. So she's studied from more of a social perception theory, kind of what factors determine trust, and she's identified kind of two dimensions, one being competence and the other being warmth. And so in her studies, what she generally finds is that scientists are perceived as being very competent, but not very warm, whereas doctors are typically perceived as being both competent and warm. So the question I wanted to ask was, with respect to the research you have been presented about correcting misinformation, I was interested in whether you could talk maybe more broadly about some more general factors that you've identified that predict when misinformation is more likely to be corrected and when it's more likely to stick around.
Okay, both very good questions. So that wasn't me, I promise. On the first point, in terms of warmth, I do think the composition of the scientific community matters and might help on that dimension. If you look, for instance, at economics, they have people who are credible conservatives who can make claims, for instance, against certain aspects of claims made by conservative policymakers, very credibly, right? So during his administration, President Bush's own economists were quietly and not so quietly saying that his administration's claims that tax cuts would not decrease revenue were wrong, right? And these were folks who are often either career, non-political civil servants or political appointees like Greg Mankiw, right? So there's something important there about having folks like that. And I think on, for instance, climate, we've often lacked folks with that kind of credibility. But the solution to that is not at all clear, and we could have a whole conference about it. The second point, though, in terms of what works, my intuition, based on what I was saying at the end, is because we have very little longitudinal data on misperceptions, precisely because we only poll on the most salient things, and as soon as they stop being salient, we stop polling them. Right? And in general, in poli-sci, we spend a long time polling trivia and not very much time polling salient factual beliefs relevant to contemporary policy issues, which I think was a mistake that we've started to change. But for we know a lot about who knows the Chief Justice of the Supreme Court relative to things that actually matter to policy choices and vote choices people make. But with all that said, I would point to when the flow of cues and social context changes. So again, we talked about smoking. I talk about this with people as maybe non-replicable, but it is a remarkable case of belief change, where it wasn't a partisan issue exactly, but it was one where people were getting two different flows of information, right? And the evidence became so overwhelming that it became embarrassing for anyone to deny it. Now, we can talk about whether that's replicable because it was driven in part by lawsuits and internal documents that aren't available on other issues, and arguably raised free speech concerns as they're now being applied in the climate case, for instance. But that evidence became overwhelming. People's personal experience with lung cancer and family members and friends became overwhelming. The cues stopped. It became so embarrassing that the cues to people became completely one-sided, and the division over whether smoking causes cancer simply went away in public opinion, right? The health behavior problem persists, but the factual misperception changed. So so smoking is in a position now that climate could be if we could agree on the science, which is to say, this is a very serious, health and policy issue, and we have some underlying factual consensus that's a kind of shared understanding, but we haven't gotten there. And my claim is that the flows of elite cues and elite information is what's going to drive that more than messaging per se. Now, messaging might help move people to start the elites moving and kind of create a dynamic that leads in that direction, but I think we've underemphasized the role of elites.
Clear for those listening in, that question was asked by Caitlin Drummond. The next question actually is by Professor Kirkland, who's there.
Hi, great talk. And I was really most intrigued on your list of best practices by the giving of the alternate causal explanation. And that seemed, I love the idea that you could actually tell people, hey, no, it's this, let me explain it. But that runs up against, from Peter's talk, the plain language problem, it seems like. That seems like one of the most promising things, but also the most difficult to convince people to actually do. And I've looked at a lot of this vaccine comforting literature, and they never do that. They almost never supply, even when I don't think it's that complicated to give. So I would just love to hear what you have to say about that. I mean, how could we have you seen good examples of an alternate causal story? Can they fit on pamphlets in nice ways that people will actually try to do? How does the plain language work? What do you...
Yeah. Unfortunately, for a lot of the cases where it seems most appropriate, it's also the causal void is most severe. So just to make this more concrete, the autism case, right? We don't have a good explanation for parents of why children get autism. That's part of the void that attributing that to vaccine helps create, right?
Broadening of the category. Why are autism rates increasing, right?
But I mean, you can even tell though, as we say the words, how hard that's going to be to communicate, right? And especially given the coincidence and timing, right? There are other cases with, for instance, natural disasters, right? The absence of the missing plane, right? Where having an alternative causal explanation for what happened would be really compelling. I don't want to overstate the case here, right? In the case of Obama's birth certificate, which wasn't a causal explanation case, but it's unusual in how definitive the evidence was against it, right? In the polling that Adam did, I think he's back there, the polling that Adam did, and others did, showed that effect lasted somewhere between a week and a month, and then it was back to where it was before the long form had been released. Okay, so that's a case where we could produce the actual birth certificate, right? So saying to someone, here's a causal explanation of this complex event, I don't want to suggest as a panacea, but it might help.
Okay, next question is by James Newberg.
Hi, Brendan. Thank you for the wonderful talk. You talk about this a little bit in the paper as kind of an open question, but how do you think, if you can speculate, how we can begin to disaggregate expressive responses from quote-unquote genuinely held misperceptions?
Oh, now you've gotten me started, okay. So this is a complex question and one where the research is very much in its early stages.
Can you repeat the question?
Oh, sure. So the question was, when people answer these, there's a concern that when people are answering these questions, they're not being sincere. They're answering expressively. And I would say the experience that I've had is that concern seems to be overstated. I can't rule it out, but The research that I've done and that Adam's done suggests that there's no clear evidence of people answering expressively. So I did a list experiment for precisely this reason, for instance, on a case where I thought there might be expressive responding, found no clear difference. Adam did a whole series of different strategies in a paper about measuring whether people sincerely believe President Obama is a Muslim, and again found no compelling evidence they were answering expressively. Now people, and I briefly addressed this in the paper, so let me just say it. There are these two papers by very, very good scholars about what happens if you give people financial incentives and how if you give them financial incentives, they're less polarized in their factual beliefs. Okay? The inference people have made from those studies that I think is incorrect is that it indicates people are hiding their true belief. Okay? And the evidence is not consistent with that, in part because in only one of the 4 studies in those 2 papers does paying people actually improve belief accuracy, which is what you would expect if it was a pure story of expressive responding versus some true belief where I know the right answer and I'm just saying something because it makes me feel good. The evidence, I think, and I'm happy to talk more about this afterwards, is more consistent with people just simply using a different approach to try to get paid. And I'm not sure how much that translates to the real world of politics where, of course, we are not paid for having accurate opinion.
I have a list of 4 people, Professor Knocklis, Levine, Vishwanath, and Gollust, and we have about 7 minutes for those 4 questions. I'd love to get to them if we can. Professor Knocklis.
Okay, I'll be really brief. Fun footnote that will surprise, that will not surprise Peter as a practicing physician and may surprise all the political scientists in the audience about our trust in our personal positions. So Eitan Hirsch at Yale has a new paper that I don't think has been published yet, where he looks at voter files and identifies the partisan identification of family physicians, and then sends patients to seek treatments from these and finds that Republican and Democrat physicians give different suggestions on things like drug use and sexual behavior. So Which
one is poor sexual behavior?
You can tell us.
Okay, next question.
I have no comment.
Is it conditional on the patient ideology? I'm just kidding.
I'm not sure.
That was supposed to be good.
So Brendan, I really enjoyed the paper, and one of the things I was thinking about as I was reading the paper was I wish you would talk more about sort of why we end up in these situations where there is this misleading information in the first place. And I think you did a lot more of that in the talk, which was great. And the field experiment results seem really kind of fascinating as sort of a first step in that direction. And so I was wondering, and I realize you don't have a ton of time, but in 60 seconds or less, could you at least talk a little bit more about what you think is the source of the incentives then for people to be misleading in the first place? Because in some cases, so with death panels, it seemed like it was more electoral competition. With with climate change, it seems like it's more donations and there's a campaign finance element going on. There could also just be other sort of personal convictions and so on and so forth. So how is this just sort of the kind of standard model of sort of candidate and congressional decision making, or do you think there's something else?
That's a really good question. Yeah, and I don't know that there's one. I don't know that there's one answer, but I do think there are cases where acknowledging the evidence puts you, you're fighting uphill once you acknowledge the evidence from a policy perspective. There's a solution aversion paper that finds that just implicating the policy, the policy that response that might be proposed is clear, people almost are implicitly backward inducting to their willingness to accept the factual belief. So politicians may be able to anticipate that and therefore kind of condition the kinds of facts they're willing to accept, but that's really a speculation.
Professor Vishwanath?
Yeah, one comment maybe for Dan and you, I think, or for everyone in the room is, it's one thing to think about these beliefs and opine on them in abstract. It's another to have a counterfactual experience which drive those beliefs. I'm thinking of vaccines, right? So as a member of NVAC and chairing the vaccine confidence working group, I lived up to here in this literature. If you talk to people in the US about vaccination and what it protects, they have no clue because they have never seen measles, personally experienced polio, or any of these diseases. So it's too abstract for them, which provides them the kind of a luxury in enjoying certain beliefs, as opposed to if you are doing this in certain countries where people are living with polio or people are living with measles or other issues. It's a real experience for them, and they are able to change their beliefs are filtered through those experiences, I think. I don't know about climate change. Climate change is, some group of elite scientists talking about climate change as opposed to personalizing it and experiencing effects of climate change could potentially influence my beliefs or filter my beliefs, I think. I'm just throwing that out. Is there a way we can change our communication strategies based on this kind of a proximity, whether it's beliefs?
Unfortunately, you need horrible things to happen to make that messaging strategy work.
but
Unfortunately,
farmers-
even that's not enough. Like, so I do this evidence-based science communication field work in Florida. So a hurricane comes in and it knocks down these two guys' houses right across the street from each other. One guy comes running out and he says to the other guy, you bastard, I told you climate change is going to do this. And he goes, what are you talking about, you bastard? I told you that if we had gay marriage that this was going to happen. And the point is, they're both equally science literate because nobody can, those are observables of some cause that is not observable. And so the theory that tells you what caused those is something you have to accept on the basis, well, maybe of additional experiments, but you didn't even do those. Those are going to be, so you won't believe it when you see it. You'll see it when you believe it. I don't see how there's any other alternative.
I think the evidence is very mixed. Like coastal communities are where you might look for evidence of effects, and the Outer Banks are incredibly polarized over climate change, despite the fact that the houses are washing away. It's still unclear what effect the Disneyland outbreak had on vaccination rates. So, our willingness to update even in the face of extreme events is, I think, somewhat unclear. And unfortunately, again, these things, with vaccines, for instance, especially, it's not an effective strategy because it depends on the disease recurring, which we're trying to prevent in the first place. And in our experiments, we tested a bunch of messages about the threat of these diseases as well, which is a kind of fallback to this, and we found no effects of any of them.
Did you ask them that they have any personal experience with those diseases?
No, we couldn't randomly assign that. So it was an experiment. Yeah, sorry, Nick, I know we're running out of
Last
time.
question goes to Professor Gollust.
Okay, I guess this is a segue question because you were ending with sort of journalistic practice perspectives on these issues, and Brendan, you also ended your talk that you think that those are the targets for our communication as a field. And so I wondered if you could speak for 25 more seconds as to what type of agenda you think is needed to better connect with the journalist community. And yeah, I'll stop there because otherwise I would take your 25 seconds.
The first thing we could do is answer their calls. I'm shocked at how many academics don't make time to talk to the press. And it could be off the record if you're worried about it, but we need to be heard. And when there's really bad coverage, they need to be shamed. There was a terrible article in Canada about HPV, and that newspaper was publicly shamed nationally. And it put its tail between its legs and ran. Like that kind of a response can be a really powerful example, but it's often not the case. So Jenny McCarthy, something happens, and some entertainment reporter writes a story that says, she says vaccines aren't safe, and it's not even someone who specializes in health. And that's a shameful abdication of their responsibility as journalists, and we need some negative sanctions too. We should laud the good reporters, but also really shame the bad ones.
On that note, let's